Hello there,
Hi,
Mr. McMullen.
that's me.
I'm Carolina.
Nice to meet you.
I'm going to be
Caroline.
the nurse practitioner taking care of you today.
Okay.
Can I call you Brandon?
Yep, you can
Okay.
call me Brandon.
Awesome. So, are you very familiar with nurse practitioners?
Yep, fairly.
Okay, so we're basically just registered nurses who went to school for more training, and we treat patients like physicians do.
Okay.
If you have any questions about my role, just go ahead and ask me throughout this whole process, okay? The first thing I'm going to do is I'm just going to go over your health history, all the basics, so that I can be able to take care of you properly in the future, okay? Still have the same phone number and address?
Yep.
Have you gotten married recently?
No.
Any children?
Yes, I have one.
A daughter or a son?
A daughter.
Oh, how old is she?
Almost 5 months.
Awesome. And what is your current job?
I work in the Sheet Metal Workers Union. So it's like construction work.
Okay. How long have you been doing that?
3 years.
3 years. Do you like it?
Yep, I do.
Most days, right?
Yeah.
So what brings you in today?
This is just a physical for my work.
A physical? When was your last physical?
About 6 years ago.
6 years ago. Oh, so you're due for one, huh?
Yeah.
Okay. Do you have any chronic illnesses?
No, not that I know of.
How about illnesses in the past that required a lot of treatment? Nothing?
No.
Okay. Any concerns about your health that you have at the moment, besides just coming in for a physical?
No.
Okay. Okay. So do you regularly get immunizations?
No, I do not.
So you don't know the last day of your Tdap booster or your TB test?
I have no idea.
And you've never received the flu, pneumonia, hepatitis B vaccines, to your knowledge?
To my knowledge, no.
Okay. Have you had any recent exposure to any contagious illnesses?
No.
Have you been out of the country in the past 21 days?
No, I have not.
Okay. Now, let's talk about your allergies. Do you have any food allergies?
Peanuts.
Peanuts? What happens with peanuts?
My throat just swells up really bad.
Okay. Any environmental allergies, like dust?
No, I don't think so.
How about seasonal? Like pollen?
Yeah, some pollen allergies.
Latex
No.
allergies? And medications?
No.
All right. And have you ever been in the hospital for any reason at all?
No.
No. Okay. What about previous surgeries?
I've just had one on my shoulder.
On which shoulder?
My right shoulder.
What did you have done there?
A labrum repair.
And when was that?
About 12 months ago.
So last
About a year.
January?
Yeah.
So January 2018.
Yep.
Okay. And when was the last time you went to the ER?
I have not been to the ER.
Okay. Now, have you had any injuries before? Like
Aside from my shoulder, no.
Okay. How did you hurt your shoulder to begin with?
From riding my bike.
Do you take any prescription medications?
No.
What about herbals?
Sometimes, would that be like essential oils?
Yeah.
Yeah, I do some of those sometimes. My diffuser.
Okay. But you don't like take any like mouth or
No.
on your skin? Okay. How about any vitamins?
I take multivitamins.
Every day?
Yep.
Okay, that's good. Anything else?
No.
What about anything that is not prescribed to you?
Like Advil?
No, like that's prescribed to somebody else that you've
Oh. No.
taken. No, okay. Over-the-counter medication is Advil. Do you take that?
Oh. Yeah, once in a while.
For what?
For my shoulder.
You still having pain in that shoulder even
Yeah.
after surgery? Okay. Anything else besides Advil?
No.
Do you use any alternative therapy like massage, chiropractors?
I use a
acupuncture?
chiropractor maybe twice a year. Not very often.
Okay. Do you do any vitamin therapy?
No.
Okay. All right. So now we're gonna go into your family history. Okay. Do you any of are your grandparents still alive?
No, they're not.
How old were they when they died?
One was 98 and the other was 89.
Who was who?
My grandfather was 98
On your mom or your dad's side?
on my mom's side.
Okay. And what did he die from? Do you know?
Cancer.
Of.
I'm not sure.
Okay. And your maternal grandmother was 89?
Yeah.
And what did she die from?
Heart failure or heart disease.
Okay. And then what about on your dad's side?
I believe it was just old age. I was pretty young when they died, so I don't exactly remember.
Both of your grandparents on that side?
Yeah.
So you're unknown. Okay. Do they have any chronic disease or mental health illnesses?
I don't
you
think
know
so.
of? Okay.
Not that I know of.
What about your parents?
My parents.
Any
My mom. No, I don't think so.
no chronic illnesses or mental health issues?
Not that.
Just healthy?
Yeah. Yep. For
Any-
now.
Any siblings?
No.
Aunts and uncles? Any chronic illnesses that you can think of on their side?
Probably a high blood pressure.
Do you know in who?
What was that?
Do you know in who?
No.
Give me just 1 second. I just gotta turn something down here. Okay. So just hypertension you think on somebody.
Yeah.
Okay. And you said you're not married. You
No.
have a spouse.
Yeah, I do.
Does he or she have any chronic illnesses or mental illnesses?
No, I don't think so.
Okay. All right. Any family history of allergies?
No.
Asthma?
No.
Arthritis?
No.
And we already said yes to high blood pressure.
Mm-hmm.
What about any other heart disease?
No.
Stroke?
No.
Diabetes?
No.
Cancer?
Yes.
In your grandfather?
Yes.
Okay. What about lung issues in anyone?
No.
How about GI problems?
No.
Thyroid issues?
No.
Blood disorders?
No.
Genetic or congenital issues
No.
from birth? No. What about brain problems?
No.
Drug or alcohol abuse?
No.
How about any learning disabilities?
No.
Okay. Do you have any concerns about any genetic problems related to yourself or your family that you want to talk about?
I do not. Nope.
Okay.
This is just for work.
Okay. All right. So personal history. How was your relationship with your family?
Pretty good.
Good. What is your current living arrangement?
I live with my family.
With who exactly?
My mom, my dad.
Are you happy with that?
Yes.
Okay. Do you get along with everyone in your family?
Yeah, I do.
So your parents, your spouse, your children. Well, she's only 5 months old, so I hope you get along with her, right?
Yep.
And you don't have siblings. Any family-related stressors that you have?
No.
Okay. Do you enjoy your current work?
Yeah, I do.
What have you done previously?
I was a welder,
How long did you do that for?
like 3 years.
Did you like that?
For the most part, yeah.
Okay. Do you feel like you're in a good financial situation
Yeah, I do.
and you're comfortable with your insurance?
Mm-hmm.
What is the highest level of education you completed?
A little bit of college, but no degree.
So just high school diploma.
Yeah.
Okay. Do you drink?
Sometimes.
What do you drink?
Liquor. Captain Morgan. Mixed drinks. Captain and Coke.
How many of those do you drink a day?
Just like 1 or 2.
No beer?
No.
Do you smoke?
No, I don't.
Do you take any drugs?
No.
How much caffeine do you drink?
A day?
Mm-hmm.
About at least 200 milligrams.
That's a very specific amount. Do you take like an energy drink that you know
Yes.
that's how? Okay. You take one of those a day.
Yeah.
Okay. Do you have a good sleeping schedule?
Yep.
How many hours on average do you sleep a night?
From 9 to about 9 to 4:50. So that's pretty much 9 to 5.
So like 8 hours
Yeah.
ish. Okay. Do you wake up often throughout the night?
No, not at all.
How often do you exercise?
I try to go 5 days a week, but it's usually about 3 to 4.
What type of exercise do you do?
What type? Like bodybuilding exercises? Would that answer your question? Like
So weightlifting?
weightlifting, correct? Yes.
And how long are you there for usually?
An hour, no more than an hour.
Okay. How clear? Excuse yourself.
Oh, can I use the bathroom real quick?
Yeah, go ahead.
Okay, I'm sorry, I really gotta go.
That's okay.
Okay, thank you.
You're welcome. Okay, so where were we? How would you describe your typical day from when you get up to when you go to sleep?
I get up, brush my teeth, then I go to work. I usually don't eat until 9:30, and I get up at 5. And then I get off of work at 2:30, go to the gym, and then go home, hang out with my girlfriend and the baby.
And sleep?
Yep.
Okay. Sounds like a pretty good day. You do that every day?
Yeah.
All right. What would you describe your food intake in the last day?
Eggs, oatmeal in the morning. Let's see, lunchtime I just had a tuna sandwich. I probably have about 3 to 4 water bottles a day,
Okay.
and then my energy drink. And I like to have pizza for dinner.
So that's what you had yesterday?
Yeah.
And is that normal for you?
Yep.
In a day? How many times do you eat out a week then?
Probably once or twice.
Okay. Do you make your own pizza at home?
No.
So you don't have pizza every day?
Well, it's like the stuff that you buy at the store and you put in the oven.
Oh, okay. All right. Do you have any special diet that you follow? Any diet restrictions?
No, not at all.
Okay. How much stress do you have, ish, on a 0 to 10 scale? 0 being none, 10 being a lot.
Probably about 3.
3. That's pretty good. What do you do to cope with your stress?
Nothing. I just deal with it. Sometimes I pray, but that's about it. I don't drink or.
Do you think that working out helps with you? doing
Yeah,
that?
definitely.
Okay. Have you or your family or friends been exposed to violence or abuse ever?
Not really.
Not really?
I mean, no, we don't.
Oh, okay.
We haven't.
Okay. Do you feel like you've accomplished everything that you've wanted to at this stage in your life?
Yes, definitely, and more.
Oh, and more. That's good. Do you wear a seatbelt when you drive?
Yes, all the time.
Very good. Do you have any throw rugs at home?
Yes, by the door.
So those are just these are safety questions that I have to ask so that you know that you have a potential falling hazard at your home.
Okay.
Okay. Stairs at home?
Yep.
Have you ever been exposed to any environmental hazards like lead or radon?
No.
What about crime or violence?
Have I been exposed to crime?
Or violence yourself?
No. I live in a bubble.
Okay. Have you ever been exposed to pollution?
No.
What about secondhand smoke?
Yes.
Oh yeah, who smokes?
A lot of my coworkers.
Okay. You should do your best to get away from them then. Do you have a religion?
No.
Do you have any specific way that you want your care providers to care for you?
Just take care of me.
Okay, we can do that. Okay, so these questions, these are not the questions I want. Hang on, I'm sorry. Maybe I do. Okay, yes I do. So these are just going to go over any symptoms that you might have in your body at the moment. We're going to go through every little piece of information that we can. It'll be a little tedious, but I just want you to bear with me, okay?
Okay.
Any fevers or chills?
No.
Malaise, fatigue, or night sweats?
No.
How about any recent weight change?
No.
What's your preferred weight?
180.
What are you at now?
175.
Oh, okay. So you're almost there. Any moles or changes in your skin?
No.
How often do you use sunscreen?
Pretty often in the summer.
Like every time
All
you're in
the
the
time,
sun?
yeah.
Okay. Have you noticed any recent hair loss or any changes to your hair distribution?
No.
And no dandruff?
No.
Okay. You have glasses on. Do you use contacts also?
No, just glasses.
When was your last eye exam?
Last year.
Okay, so you keep up to date on your glasses then.
Yep, I do.
Good. Any visual problems like darkening, like random lights, floaters that you can see? Any?
No.
Okay. How about a lazy eye? Have you ever had?
Nope.
What about any eye infections recently?
No.
Have you suffered from hearing loss?
No.
Any ear pain or discharge?
No.
Ringing in your ears or dizziness?
No.
How about hearing aids? You don't have any that I can see?
No, I don't have hearing aids.
Okay. Any nosebleeds?
No.
How about when was your last cold?
It's been a long time. Probably 3 years ago. I have been very lucky.
Yeah.
It's my macronutrients that help.
You have any sinus pain?
No.
How about, no, I mean, the only allergies you said was pollen.
Pollen, yes, and peanuts.
Yeah. Okay. When was your last dental exam?
A year ago.
So everything gets checked up on except for your whole body, huh?
Yep.
Any missing teeth?
No.
Fake teeth, bridges, caps, dentures,
No.
retainers? None of that. All yours. How often do you brush?
Every morning and every night. So 2 days,
Two
two
times
times a day.
What about flossing?
I do not do that. I wish I did, but I don't.
Okay. So not often.
No.
Only when you get something stuck in your teeth, right?
Yep. From corn.
Any sore throat?
No.
Have you ever had strep?
Yes.
How long ago was that?
2012.
Okay. Difficulty swallowing foods or liquids?
No.
Any voice changes that you've noticed recently?
No.
What about stiffness in your neck?
No.
Can you move your neck without any pain in every direction?
Yep.
Any lumps that you felt in your neck or any tenderness that you felt?
No.
What about any lumps or soreness in your breasts?
No.
How about any discharge you've noticed from your nipples? Have you
Nope.
had a cough recently?
No.
Any shortness of breath?
No.
How about wheezing?
No.
And no history of asthma, pneumonia, bronchitis, emphysema, nothing like that?
No.
Any kind of heart problems that you yourself have?
No.
No high blood pressure?
Not yet.
Hopefully not. How about chest pain?
No.
Has anyone ever told you you have a heart murmur?
No.
Do you have any kind of exercise intolerance or harder time doing any specific kind of exercise?
Not really.
No?
No.
Ever feel like your heart skips a beat?
No.
Any swelling anywhere that you've noticed?
No.
Do you have any idea what your cholesterol levels are?
No idea.
Okay. Any abdominal pain?
No.
Nausea, vomiting?
No.
Diarrhea or constipation?
Nope.
How regular are your bowel movements?
Very. Probably every morning when I wake up, it's ready. And probably 2 more times after that.
So 3 times a day.
Yeah.
Do you have to strain?
No. Not at all.
Okay. Any rectal bleeding?
No.
She's gonna fall out.
No.
Have your glands ever swelled up in your groin?
No.
Any history of ulcer disease, gallbladder disease, or soiling yourself?
Can I be excused real quick? I have a phone call.
Yep.
Yeah. Okay. Thanks. Bye. Sorry about that.
That's okay. Any history of ulcer disease, gallbladder disease, or soiling yourself?
No.
Okay. Any pain in your back?
No.
Do you have any trouble urinating?
No.
Any blood in your urine?
No.
How do you urinate? How often do you urinate usually?
How
I know that's
often
kind of a hard question to answer.
1, 2, 3, 4. We'll go 5 to 6 times a day, maybe more, probably more.
Okay. Do you go to the bathroom at night?
No.
Any infections recently, UTIs or sexually transmitted infections?
No.
Any penile discharge?
No.
Do you use anything in case you do soil yourself? Like pads, depends.
No.
Okay. How often do you perform testicular exams?
Never.
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 Well, I'll teach you how to do those, and you're gonna have to start doing them on your own.
Okay.
Do you know if you have any fertility problems?
I do not know. I don't think so since I have a baby, but I still might.
Okay.
I don't know.
When was your last prostate exam?
2 years ago? No, wait. I'm thinking of something else. I don't think I've ever had one.
Okay. Never. Because last time you had your physical was 6 years ago. They probably didn't do one then because you were young.
Yeah.
True. Okay, so the next set of questions are a little bit uncomfortable, but they'll be quick as long as we get through them, and they'll stay between you and I, okay?
Okay.
Do you have sex with women, men, or both?
Woman.
How many people are you currently sleeping with?
1.
How many people have you slept with?
2.
What do you do for protection?
I wash my hands. That's about it.
I meant, what do you do for protection, like your sexual protection?
Yeah, nothing.
Nothing. Is your girlfriend on anything?
No.
Okay. Do you enjoy your sex life?
Yes, for the most part, yes.
Okay. Alright. That's all I need to ask you about that.
Oh, that was easy.
Yeah. Any pain or stiffness in your back or joints?
No.
Just in your shoulder?
Yeah. Just my shoulder.
Do you have limited use of any of your limbs, like your arms or your legs?
No.
No? Do you walk like you've always walked? No limp?
Yep.
And no swelling or weaknesses that you said?
No.
Do you have any history of any head injuries?
No.
Have you ever lost consciousness?
No.
Okay. Do you feel like you've been losing coordination?
No.
Have you been dizzy recently?
No.
Has anything been numb or tingling?
No.
Have you had slurred speech?
No.
Any seizures, tremors, or headaches?
No.
Do you feel like your mind has been in its normal functioning level as it's always been?
Yeah.
Any memory problems?
Nope.
Are you more irritable or have any mood swings?
No.
Do you have any blood illnesses that you know, like sickle cell, any anemias?
No.
Do you bleed easily or bruise easily?
No.
Have you ever had a blood transfusion?
No.
Do you have any thyroid issues?
No.
Are you sensitive to the hot or cold?
No.
Do you urinate a lot?
I think I'm pretty normal, but I don't really know. No, I'm not gonna answer that question.
Like, do you feel like you go way too often as compared
No.
to... Okay.
I don't.
Do you eat a lot?
Do I eat a lot? No, I don't.
Are you normally really thirsty?
Yeah.
So those questions are kind of the base questions to assess if you have diabetes or anything like that. Okay, because those are the three basic signs of if you become diabetic, what it would look
Peeing,
like,
eating.
and being really thirsty.
Um,
Okay. So those are all the questions that I have for you in terms of your health history. Do you have any questions about anything that we did? No?
no.
Okay, so I will go ahead and get the nurse. She's going to take your vital signs and give you instructions on what to dress up in for your physical exam.
Okay.
Okay? I will be right back.
Okay.